Hello, my name is Uchenna Obornaya. I'm a fourth-year PhD student at the University of Utah's Rocky Mountain Center for Occupational and Environmental Health, studying occupational injury prevention, and thank you for coming to hear about my poster. This poster describes a research study examining occupational hazards for hotel room cleaners in the Salt Lake City area. Hotel room cleaners, or HRCs, have the highest rate of overall musculoskeletal disorders, or MSDs, among any hotel hospitality worker. These musculoskeletal disorders can result from a lack of fit between the hotel room cleaner and the job they are performing. A poor lack of fit can be anything from poor technique, having improper tools, or not physically being able to perform tasks for the requested time frame. However, not only can physicality cause poor fit, but mental stressors can also add to the equation of poor fit in hotel room cleaners and their jobs. Therefore, the study investigated the relationship between physical and psychosocial stressors and the prevalence of musculoskeletal disorders of low back pain or shoulder pain in hotel room cleaners. This cross-sectional study used a questionnaire that inquired about biomechanical and psychosocial stressors and other basic demographic questions. The questionnaire was administered in English and Spanish, and a translator was present to help clarify any questions, and the questionnaire took approximately 45 minutes to complete. The two stressors collected in the study were biomechanical in the form of number of beds cleaned, the number of bathrooms cleaned, and the number of beds and bathrooms combined during an 8-hour shift. And the psychosocial stressor was measured in the form of a quantified job questionnaire score. The outcome variable of low back pain and shoulder pain were measured at 3 prevalence levels: pain experienced in the last 12 months or year, pain experienced in the last 7 days or week, or pain experienced the day that they were filling out the survey. The initial results of the study yielded no statistically significant odds ratios. The non-significance may be a result of low sample size of 36 participants in the study, but the researchers noticed that there was a trend toward significance in the data, a cluster of results with a p-value of less than 0.20. After an exploratory analysis, the results showed statistically significant odds ratios between the shoulder pain experienced this year and the number of beds cleaned, as well as the low back pain experienced this week and the number of beds and bathrooms cleaned together. So what do these results mean? Because the study was underpowered and an exploratory approach was taken, it's difficult to make any hard conclusions about the relationships investigated. However, I think that the data does show a trend that in the data, there is some sort of U-shaped relationship when it comes to the stressors and the musculoskeletal disorders of the hotel room cleaners, suggesting that there may be a threshold that the hotel room cleaners need to surpass to then decrease their odds of injury. Something like a work hardening effect may explain the nonlinear relationship, but more research is needed to confirm the conclusion. Future studies should investigate if there is indeed a nonlinear relationship in this association. That concludes my poster. Thank you for coming to have a look, and thank you for listening.